Hello.
Hello.
My name is Zach. I'll be your nurse this evening. Basically what we have is an order to do a head-to-toe physical assessment. Should only take me about 20 or so minutes.
Alright.
Can I have your name and birthday just to clarify?
My name is Jordan Casper, and I was born on June 5th, 1995.
Alright, thank you. Mr. Casper, I shut the door to just give us some privacy and I'll do some hand hygiene.
Thank you.
Do you have any allergies, Mr. Casper?
No.
Alright, on a scale of 1 to 10, what's your pain rating?
1 to 10, 1.
Sounds good. That would finish our introduction. We would then move on to general appearance. There is no sign of acute distress in Mr. Casper's facial expressions. His facial expression is appropriate. He's smiling. His mood is pleasant, happy to help. His speech is fluent. No abnormalities there. Mr. Casper, could you tell me my name?
Your name is Zach.
Where are we at?
We're at my house.
What year is it?
It is 2020.
And what are we doing?
We are doing what your class ordered, a physical.
Sounds good. Alrighty, we would then move to assess the skin. First by noting any color change like pallor, cyanosis, or redness on the skin. None is noted. We would note any wounds, lesions, or incisions, but none are found. We would continue on by palpating with the back of our hands on the arms to test the temperature. We would assess the fingernails for the correct color and shape and contour. We would assess capillary refill under 2 seconds. And that finishes our skin portion. We would then move to head, face, and neck. We are first assessing or inspecting the face to make sure we have symmetry between facial structures, which we do. We would inspect the head itself for any lesions or infestations. None are found. We would move on by assessing cranial nerve 5. So Mr. Casper, if I could have you clench your teeth. And then with your eyes closed, if you could just tell me if you feel this.
Yeah. Mm-hmm. Yup. 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 Yes.
Cranial nerve 5 is intact. To test cranial nerve 7, Mr. Casper, could I have you puff your cheeks? Thank you. You can release. And then could I have you shrug your shoulders and then turn your head side to side. That confirms that cranial nerve 12 is intact, or cranial nerve 11 is intact. Yes. We would then continue by assessing the eyes, noting if there is any redness or discharge. None to be noted. If the conjunctiva and sclera are intact, which they are, conjunctiva is nice and pink, sclera is good and white. We would assess the pupils. We're making sure that they are the correct size, the correct shape, that they are equal to one another, and they are reactive to light. If we had a Snellen chart, we could test accommodation, but we do not. So we will continue on by doing the 6 cardinal fields of gaze. So Mr. Casper, we're going to match my left eye with your right eye so we're on the same side looking so. And you're going to tell me if you can see this finger, so just move your eye to where, but not your face, just your eye.
Okay. Yeah. 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 Yep.
Alright, switch eyes.
Yes.
Nope, just
Sorry.
your eye, just your eye.
Yes. 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 Uh-huh. Yes. Yep.
Alright, that confirms that cranial nerves 3, 4, and 6 are intact. That finishes the eye portion. We would then move on to ears. We're noting any discharge or drainage from the ears, but none are to be noted. And we would do a whisper test to confirm the auditory cranial nerve.
Star Wars? health assessment.
Thank you. That finishes our ears portion. We would then move on to our nose. By basically inspecting the nose, we're trying to look for any deformities, any asymmetry, or any inflammation. None to be noted. We would test bilateral patency. Inhale. Inhale. And exhale. No abnormalities found. And then we would inspect the inside for any signs of drainage. None to be noted. As we continue to the mouth, we're assessing the lips, the gums, and the tongue for making sure that they are red or pink and moist. So you can show me your teeth and gums. And then we would continue on. I'm going to just depress your tongue and you're going to say ah, so stick out your tongue.
Ah.
And then I'm going to test your gag reflex.
Yep.
Sorry. We will then continue by assessing cranial nerve 12. You could stick out your tongue. And then repeat the words just normally. Light, tight, dynamite.
Light, tight, dynamite.
Alright, thank you. That finishes up our mouth portion. We will then continue on to the respiratory, cardiovascular, abdominal, and musculoskeletal. So for this portion, Mr. Casper, could I have you remove your shirt? So first we would assess that there is no use of accessory muscles for Mr. Casper while he's breathing. And then we would continue on by auscultating the lungs with the diaphragm. 6 to 8 positions going side to side, starting with the right upper. Then give me 2 deep breaths. 1 more. And then you would listen posteriorly. Just breathe normal, Mr. Casper.
Right.
And then give me 4 deep breaths. 1, 2, 3, and 4. Alright, no abnormal lung sounds were present while auscultating the lungs. We would then continue to the cardiovascular portion of the exam. If you could just sit back for me so I can palpate our carotid arteries. You want to do this sequentially, not at the same time. You want to assess for edema by looking at the distal portions of the body, like the hands or the feet. No edema is present. We would then auscultate the heart sounds in the 5 positions: aortic, pulmonic, Erb's point, tricuspid, and mitral with both diaphragm and bell. No abnormal heart sounds were present, no murmurs. We would then palpate our radial pulses. We're looking for an even pulse in both sides. Mr. Casper, if you could remove your socks for me, so I could palpate the dorsalis pedis pulse. And then the posterior tibial. And then also, if you could leave your pants up, if you could close your eyes, we're going to test the sensory of your lower extremities.
Alright.
So you're going to tell me if it's the sharp side or the soft cotton.
Alright. Soft. Sharp. Sharp. Soft. 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 Sharp.
Alright, thank you. That will finish our cardiovascular and peripheral vascular system. We would then move on to abdomen. So we're first inspecting the abdomen, checking the shape and the contour. It is nice and flat, nothing protruding. It's nice and symmetrical to each side. We would then auscultate bowel sounds starting from the right lower quadrant, going to the right upper quadrant, left upper quadrant, left lower quadrant. You would use the diaphragm. You would then, no abnormal bowel sounds are present, no hypoactivity or hyperactivity. We would then palpate the abdomen, starting in the same order, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. No distension or tenderness would be noted. And we would continue on with our musculoskeletal portion of the assessment by doing a range of motion for upper and lower extremities, also assessing the shape and contour of the muscles. So for the upper extremity, we would assess bilaterally or each side, Mr. Casper. With our right arm, we're going to flex, extend, and then we're going to pronate, and then supinate. Alright, and then with our left wrist, we're going to extend and flex. And then we're going to abduct, so turn towards you, and adduct, turn away. Alright, notice that there was good shape and contour in the muscles, and that the range of motion was present. We will then do with the lower extremities as well. With your left leg, sir, will you flex your leg and then extend? And then with your right foot, will you flex and touch your toes to the ground? Right foot? Yep. Okay, and then extend your foot up. Alright, range of motion is present. There's good shape and contour in the muscles. We would then assess... I messed up, Mr. Casper. This is when we would assess the sensory portion of the lower extremities, not during the cardiovascular and peripheral system. So we would do that again, and we would test the soft or the sharp.
Alright.
But we already did that, which showed no abnormalities to that. We would then test the strength of the muscle system. So I'm going to have you push your hands up against mine.
Okay.
And then push down. And then with your feet, I want you to push down and then push up. Alright, no abnormalities or issues found with the musculoskeletal system there. And Mr. Casper, I'm going to have you walk from this corner over towards the camera.
Alright.
We're going to just be assessing your gait. If there's any issues with your walk, so just walk normally. No abnormalities found in the gait. You can take a seat, Mr. Casper. Alright, we're going to reassess your pain level on a scale of 1 to 10. How are we feeling?
Feeling great. 0.
Okay. Well, thank you, Mr. Casper. I'm going to make sure that our bed's in the lowest position, the side rails are up, and it's locked. I would give you your call light. I would redo my hand hygiene now that we are finished, and thank you, Mr. Casper.
Thank you, Zach.
Have a good night.